Greetings and welcome to another episode of Black Mental Health Matters. Thank you for joining us today for another insightful and engaging conversation. I am Lakeisha J. Rigg, CEO of LJR Training and Coaching. I'm also an educator and a mental health advocate. We have a topic today: access to care, navigating the mental health system as a Black person. And we have joining us Dr. Cloud and Myro Amaju. So stay with us. Welcome, Dr. Cloud and Mayro. Did I say that right?
Yes, you did. You did.
Okay, yes. Thank you both for being on the show today. So happy to have you. We are going to be discussing this important topic of access to care, navigating the mental health system as a Black person. So, starting with Dr. Cloud, if you could just tell the listeners a little bit about yourself, and then Mayro, and then we'll get into this topic. Thank you so much.
Greetings, all. So my name is Dr. DeQuavion Cloud. I am a public health social worker, so I currently do HIV and STI outreach here in my hometown of Charlotte. I am also a professor, so I teach about 6 courses across 2 different universities in our Bachelor of Social Work program, kind of preparing the next generation of social workers. I'm an author of 2 self-help books for Black men, pretty much trying to show Black men how to pretty much how to kind of lean into our emotions because we're not really that. Uh,
Mhm.
and yeah, that's pretty much a lot about me.
That's a lot right there. I was like, if you have more, I don't even know, but snaps and claps, snaps and claps. Thank you for sharing that.
Yeah, and the last thing is I currently sit on 2 nonprofit boards. So one, I sit on the board of directors for one organization. Is one of their youngest board members in the company's 20+ year history. Pretty much overseeing all of their mental health recovery facilities.
Mm,
And then I also sit on another board of directors for a nonprofit which works with recently incarcerated individuals and reentry
mm.
society. So proud to be here. Glad to be here to talk about such an important topic that's important to my heart. So yeah, that's me.
Thank you so much. Listeners, we are in for a delight with all the knowledge and gems that will be dropped today with Dr. Cloud and Mayro. If please share about yourself as well.
Yeah, thank you so much. My name is Mayro Amadou. I am Winnipeg-based in Canada. I am multifaceted, but I am appearing here or being present here mostly from my therapeutic lens. I'm currently completing my master's degree in counseling psychology, so I primarily see private practice clients at the moment, and then just kind of supporting community however I can. With my other work, I am also a researcher and have like extensive background in doing mental health research, and also substance use kind of research and how it ties to mental health in general. So yeah, that's me.
Thank you. Yes, two dynamic individuals today joining us. I am just grateful to be in your presence. So thank you so much again. And we will get into our first question. What are some of the most common barriers Black individuals face when seeking mental health care? Whoever might want to answer that. And if somebody wants to add to it after, that would be super helpful.
So I'll take this first. Yes, I think that's the best way to do this. So when we're looking at barriers for mental health access for Black people or persons of color, what we're first seeing is not stigmatization. So when I say about stigmatization, so there's this stigma associated with mental health therapy, predominantly for Black men, but there is no stigmatization for mental health therapy for Black women. So that's a difference. So, and what I say by that is that men of color often do not seek mental health services because there's this stigma that men must be tough, men do not have emotions, men do not cry, versus women can seek mental health services because they're seen as emotional, the backbone of the Black community, and need somebody to talk to about their emotion. Now, stigmatization is not the only thing that kind of serves as a barrier. We're also looking at socioeconomic status and also race as well. And so there are a lot of Black clinicians, and most Black people want somebody who looks like them, who can understand from the same racial and socioeconomic background as well. So those three to me are the biggest barriers. Now there may be more, and of course there's always is more when you start to dive deeper into it. But the three major ones are socioeconomic, race, and stigmatization. And stigmatization have to break it down because if you look at the data or data, however you want to pronounce it, for Black men and Black women, you will see that Black women utilize mental health services more than Black men because they do not have that stigmatization behind them. They are already labeled as prone to seek services because of postpartum depression, after birth that happens. So Black women are given more of those resources to utilize mental health services than Black men.
Yes, very good points. Thank you so much, Dr. Cloud. Mayro, if you would like to add something to that.
Yeah, I thought it was very timely. Like you mentioning, Dr. Cloud, about like the gender differences in there. That's definitely there. I think for me, one of the things that I see mostly, I live in Winnipeg, Manitoba, in Canada, which is predominantly white in so many ways. And so even having cultural competent therapists that could really attest to like the Black experience or what it means to be a Black person is we are pretty low in number. And so even with my clients, when they come to me and they're like, oh my God, we finally found a Black therapist, I'm like, there aren't, I hear you, there aren't enough of us. And honestly, that's kind of what motivated me to go into this field. It's like I do want to be that representation, and I do want to encourage other people too who are thinking about pursuing this to actually do as well, because we need representation. We need that cultural competent care that comes with that representation. And also something that came up for me was also trusting in the healthcare system here because I'm predominantly white. It took me 5 years before I sought therapy for myself. And it's the process of the finding, it's the process to really navigate the system in a way that doesn't just cause more harm to you, but actually really supports you in the way that it should. But then when a system is not built for you or built with you in mind, then that just really brings up a whole lot of kind of worms that can help just kind of just then goes to the side and not really something that folks actively sought out. And so even like thinking about the gender differences, as you said, and me being like a queer person, then there's the added layer of where does my queerness come in terms of even therapy as a queer Black person or as a queer Black woman. And so like seeing that is
Mm-hmm.
the more intersections you have, the more barriers I think people face in actually accessing care.
Oh my goodness. Absolutely. So many things that both of you have shared, I'm sure will resonate with our listeners. From representation, that is so true. You know, wanting to be able to see someone that looks like yourself, feeling like that you can trust that person, they'll understand where you're coming from. And just the whole trust piece is so true, like trusting a system that was not built for us. It's such a good point. So more of us in these spaces can definitely help out for us to go ahead and access that care that is needed. And it's as if you're both kind of already like going along the lines of what it is that I'm gonna ask. So I love that. So the question then, which you already touched on, but you can add to it if you like. How does the mental health stigma, as one of those things that are barriers, how does that affect the behaviors of those in the Black community? So specifically the stigma, which both of you have touched on, or Dr. Cloud touched on more so.
So I would say that with stigma, what we see more, and I think we often overlook it. And as I'm trying to say, Mero say, I hope I said it right. Your name.
I know I'm trying to, Mayro, right?
Yeah. If you forget it, just go mirror your boat in your boat.
Okay. Yeah. So as Mero said earlier, we have to look at that's like distinction with stigmatization though. Like with Black men, what we see when it comes to stigmatization and how does it affect the Black community, what we see is a suppression, right? So we see a suppression of emotion, we see a suppression of thought as well, because they don't know they don't know where the outlet is at to kind of speak about their mental health issues, right? And so even Mara said something about being queer. Now imagine if you are a queer Black man, a queer Black woman, right? So the stigmatization now is even double, because you can be a Black man, but you can't be queer. You can't be a part of the LGBTQ community, and you cannot be less masculine than the man presented before you. Versus Black women, when it comes to stigmatization, is they can be queer, they can be all these things, because at the end of the day, they are a woman. That same stigma will not hold to them, because as women are looked at to be everything. A woman can be queer, a woman can be straight, a woman can have mental health issues, and she would get the resources.
Right.
When it goes to Black men, and I'm showing you all the difference, is because we often talk about stigma, but we never talk about the stark difference between gender when it comes to stigmatization. And so with Black men, we started to see high risk of suicide. We started to see high risk of aggressive outbursts. We started to see higher uses of narcotics, substance abuse, all these different types of things. And then we always wonder why a lot of men are what we call sexual deviants, because they don't know how to, or they do not have the space to kind of express themselves sexually as well, and that affects their mental health too. So you wondering why a lot of Black men are having multiple partners, or as we love to coin the phrase, a DL. You know, they're with women because society says they have to be with women, but mentally they want to be with a man, so they sleep with men on the low because they cannot talk about it. So how that stigma kind of affects the behaviors of those in the Black communities, because it differentiates. Again, with Black women, Black women don't have to be DL. A Black woman can say today, yeah, I slept with a female. It's not really anything I liked. I just did to get it out the way to see if I liked it or not. She would not have that judgment or that stigmatization behind her. Versus if a Black male says, well, yes, I messed with a guy before, he will forever be labeled as gay. No matter if it's one time in undergrad or one time in his life, just to say he's experimented, he will always have that association behind him, and then that stigma will always follow him.
Yeah, that's a very good point. So among other things that I'm hearing, Black men are sort of held to like higher judgment, especially as it relates to being in the LGBTQ plus community. A Black woman could do whatever and still be accepted and supported. So for Black men, that not being the case, manifests in different ways, and including but not limited to different aggressiveness and deviancies and things of that nature. That's a very, very good point. Mayro, would you like to add to that?
Something about Dr. Cloud said that makes me think of hypermasculinity, and I think like in the in the Black community, like that is something that is facilitated, I think, throughout history of how men are supposed to behave and show up and navigate life. Something that also, in terms of like talking about gender and mental health stigma, I know like women, Black women also face the stereotype of a strong Black woman, and we can always be strong and we can't break. We just always support and support and support and support. And I think that in its way, that in itself carries its own weight. I grew up like watching my mom be the strong Black woman. I saw my dad be also like having the stereotype of being more like hybrid, display more of hybrid masculinity as opposed to hyper masculinity. And I thought also that like he was perceived as being like problematic because he embodied more of the feminine and the masculine energy like equally. And that was also an issue in itself. So really like having growing up and seeing those two stereotypes for me really like put things into perspective of if my mom was to go seek help, it's going to be like, but you just have to be strong.
Yeah.
And that is actually just what people say. And then when my dad was going to do it, it says like, why are you being so feminine, you know? So it's like
Right.
not a win with both sides. And honestly, like I know that there are spaces where sometimes I'm like, maybe talk therapy doesn't work for men as much as it does for women. And like questioning that. And even like, how does community show up differently for different genders? You know, like men could talk in a barbershop and really like that is very fulfilling and helpful for their mental health because they can just talk to their guys and like, you know, women on the other hand, like we have much more deeper relationships and there is much more acceptance with in our friend groups than there are in male friend groups. So really like highlighting those two differences. It's kind of like very fascinating to hear Dr. Cloud talk about masculinity in different ways and how it ties to my own research about masculinity and how men particularly navigate the mental health system.
Yes. Oh my goodness. A lot of good nuggets of wisdom there. And, you know, as it relates to the strong Black woman, most, if not all of us have heard that, whether directly to ourselves or just in any, you know, various readings or, you know, movie showings or just anything. That is something that we hear a lot, just, you know, be strong. Meanwhile, we want to get support, which we do seemingly, as what I'm hearing, more so than Black man. But nonetheless, to go into any space and try to get help and just to hear, well, you just, you know, you just strong, just, you know, work it out. That's not necessarily helpful for us when we came for care. We came so that we can, you know, find ways to help learn how to live our lives, including but not limited to setting boundaries, right? So that's a very important point, the whole, you know, strong Black woman mantra that is placed on us. And then just the point of the differences, you know, with males and females and, you know, what might work. Talk therapy would more likely work for women, just the way we're socialized in our friend groups to talk about things, but maybe not so much for men. And I like how you mentioned that the barbershop, for example, could be a space where men might feel more at ease to just talk about things. So more informal, not necessarily always like a formal therapeutic session as females might gravitate towards. But Dr. Cloud, I would love to hear your input as we navigate to the next question that both of you have already been touching on, the differences in the behaviors of Black men and women as it, you know, manifests in these stigmas. So Dr. Cloud, if you want to add on to what Mayra was saying, especially as it relates to, you know, how Black men, Black males might, you know, better receive some therapeutic sessions, be it informally, barbershop, etc.
So barbershop talk and beauty salon talk are two different things, right? And the reason I can say that is because Meryl did say something great about how with the barbershop, it's kind of like a sort of therapy, right?
Mhm.
And so in the barbershop, what we often see or what we often deal with is that in the barbershop, it's this openness, this transparent to talk about anything, right? It's this
Mhm.
kind of, but also it's kind of detrimental as well. And because in the barbershop, if you have children, if you have a child, or if you ever been in the barbershop before, you'll understand that the topics vary.
Mhm.
So usually it's sports, women, sex, or some type of nonsense that's being discussed, right? And so if you are in the barbershop, and sometimes you'll hear people talk about their personal lives, like guys will talk about our personal lives as well. And so sometimes it can be therapeutic, but it also can be detrimental to a black man's mental health as well, depending on what topics are being discussed. So for instance, I've often heard, or when I've had a therapy client before, his biggest fear was going into a black barbershop because he was gay, right? So when they're
Mhm.
talking about sports, when they're talking about females and all this stuff, and they're using the term B, or they're talking about the woman's body parts, stuff like that, he's sitting there quiet because he doesn't want to be intermeshed into this conversation, because he doesn't want them to judge him or look at him differently, because he don't know nothing about what they're talking about. He don't watch, he don't watch sports. He don't know nothing about the female anatomy. He just there trying to get a haircut. This is not therapy for him. This is actually a fight or flight response for him, because he doesn't want anybody to come out their mouth and say the wrong word, right? Because in the barbershop, you hear a lot of people drop the F word.
Mhm.
You will. You hear a lot of homophobia in the black barbershop as well, depending on where your barbershop is. I grew up in a very old school barbershop, so you'll still hear the homophobia, you'll still hear the misogynist comments as well about women. About the women they slept with, how it was, and stuff like that. And so barbershop talk again can sometimes be beneficial because it is a village of black men who can have these conversations, but it also can be detrimental to certain black men because that stigma or that fear of I have to be masculine in this space. I have to present myself in a way that does not come off as feminine, because I don't want them to look at me funny or to judge me or to talk about me while I'm here. And versus the beauty salon. Now, I had the chance, or I had the honor and growing up in a beauty salon with my aunt. My aunt owned a beauty salon. My mom would go. I would be there every Saturday at 8 in the morning till whatever time we left. Because in the black beauty salon, your appointment may be at 8. It ain't at 8. Is whenever she starting your hair, and you will leave whenever she get done. It may be 9 at night. If you don't got no babysitter, your kids are right there with you in the corner. So I grew up in a beauty salon, and I would hear how women would talk with each other, and you would hear the sisterhood, and you would hear how they just talk about their problems, right? You know, you hear about somebody, their husband cheating on them, and all the women are pitching in, talking about, let's talk about it. Or they're having problems with their kids. You'll hear the black women, oh, well, let's talk about that. And they'll talk about their different ways of rearing their children, what worked for them. They've been through this before with their child. And you see the village, which you don't see the toxicity in that environment, because, again, as Mara say, it's the black woman syndrome or black woman strength, right? They don't have the opportunity to be in a different lens, in some way. I'm trying to explain this the best way I can. To them is, we're mothers, we're aunties, we're grandmothers, we're all these different roles. But so we always have to make sure that we're in this type of role, because we never know who's gonna need us. Versus black men, we just gotta be men. We just gotta be masculine presenting, be aggressive, and act like we got some common sense. And that's pretty much it. We can never show any other type of emotion. That's really what it is. And so those two different spaces have always been different for us. But with women, the beauty salon has never been a toxic environment, unless you have a female coming there because you've been cheating with her man. That's a different story. But the beauty salon has, and we've all seen it before. The woman don't know the man is cheating, and the other woman goes to the same beauty salon. That's rare. But it all goes to show that those women still bond together in sisterhood, because they're going to talk woman to woman. Versus with men in the barbershop, that's not the same objective. So that becomes different. That becomes different. The behavior start to show as well, because you have a village of a sisterhood, and then you have a semi village of brotherhood. But that is only that only goes to the extent of, are you straight and are you masculine?
That was a really great sort of explanation, visualizing the two spaces, barbershop, beauty salon, and how, as you said, the sisterhood would be more supportive no matter what, generally speaking, as opposed to the barbershop. It's really a quote unquote safe space if you are like a straight male.
Yes.
Um, that's a very good point. Mero, do you want to chime in on that? That was really good. I feel like I have nothing to add or take away to that.
I think the only thing I would add to that is just more affirming what Dr. Cloud said, and saying also like how really like our intersecting identities that we embody or that we present with really influence the way we show up and present ourselves, and also how we occupy space in different spaces. So really like just saying, yeah, like that is very real. If you present a certain way, or if you embody all your intersecting identities a certain way in certain spaces, definitely it might be a different experience for you compared to somebody else who, especially if those intersecting identities don't fit with the norm of a particular space, then it's more of a harm for you as opposed to be something that's healing or something that is should be good for you.
Yes, exactly. It could very well not be a safe space, a healthy space, could be a harmful space. The sisterhood, as you said, generally speaking, might be a bit more supportive than the brotherhood. And also too, just to go back to what you said, Dr. Cloud, about, the village of women, and okay, let's talk about it. If your man is cheating or whatever, or your child or whatever, and sort of like that advice being given. And that's interesting too, because depending on the advice that's given, someone might go forward, in that village of women with certain advice that may not necessarily be what is best for them in their situation, their circumstance. So even though we know it happens, we know people talk about their business in all these spaces, barbershop and beauty salon, but really try to honing in on what we're talking about, getting care and having, those therapeutic sessions from someone that can sit and really work with you is really ideal, because in these spaces, you don't know, you walking away, you might be more confused than you came in. I've been there, talking about a whole bunch of stuff. And I mean, maybe, I don't know, maybe I'm leaning into a bit of my masculinity because I just like to get my hair done. I don't always want all these conversations, but that just might just be me. So, but we're going to move on.
No, I hear you with that.
And I do agree. Like growing up in the beauty salon and the barbershop, I can see both spaces. I never understood how when women they'll just be talking and they'll be talking about everything under the sun, but it to them it's sound advice. Like, and then growing up in the barbershop, I just be sitting there quiet as my dad is talking or my cousins are talking, and I'm just like, I don't know what nobody's talking about, so I'm just here like. As I got older and I started really getting into the conversations, I'm like, yeah, these conversations really are not good for your mental health. Let's talk about something different. Let's change
everything and anything, and I'll just be like, in my mind, like, I just came here to get my hair done. Don't get me wrong, I'm a friendly person, talk about stuff, light talk, what have you, but people just be getting deep, and I'm like, okay. And then, oh my gosh, what you said about you have an 8:00 appointment, it don't start at 8. Oh my, that part right there, that give me anxiety. I don't want to be there all day and night. Not me.
Your appointment at 8, you'll be in a chair by 10.
Now y'all really telling the truth. Okay, let me, because this conversation. So we're gonna go, because I'm having flashbacks. Let me stop. Okay. So what role do socioeconomic factors play in access to mental health care mental health service rather, for Black individuals? So which one of you would like to start with this question?
I'm gonna let Mero take this one.
Okay, go ahead,
Okay.
Mary.
I think like there because historically, the Black community has been very marginalized, very low on the socioeconomic status ladder. Um, I would say honestly, like sometimes just meeting basic needs are at the top of the ladder, and therapy is like very. I grew up looking at therapy as this like very bougie thing that only certain class of people can afford, honestly. Um, and so even that informs my practice in the way that I offer care, and just like knowing that not everybody can afford care, and like what are the loopholes in the system that I can support my own clients if they maybe, let's say, they can't really afford to pay private practice. What are the other options that are available? It makes me think, recently I had a client who couldn't afford therapy, and they were just about to like give up on me. They were just like, I can afford this at the stage I am in life right now. And so like I'm gonna stop therapy. And I was like, well, we had one session and you really talked about really important things. I really do want to support you in exploring that for yourself. And so I was like, I don't even care at this moment, but like if we can find a plan, be it sliding scale, be it whatever, be it referral to a community health, like let's talk about this because it's really dear to my heart that you can access care. And so even like making those little I feel like because of my experience, I am able to like offer that, but also knowing that not everyone might think that, or not everyone might be as a therapist. Like, you can offer a sliding scale, but also you got to eat. Like, you can't just like offer that to everybody, but also like just being aware that this is a reality for most people that are Black presenting or are Black, and you just kind of have to figure out a way to also support them through that, because number one, there's so many barriers as we talked about in accessing that care. And so even getting someone through the door and being like, hey, you like, it's such a courageous thing to actually seek help and like be on that consult call and like move forward, between your first session as a Black person. So once you're in that door, I think like it rests on us as Black therapists, Black practitioners, to really support that for our community, honestly, in so many ways. So maybe that's my 2 cents about that.
That's a lot of good. More than 2 cents. That's really good points. Because just the courageousness of it all, that's so true. We talked about, among other things, the stigma, and the representation lacking. So just to even come through the door is courageous for a Black person. And so I love how you said, Black practitioners, therapists, finding ways to help, be it sliding scale or otherwise, to try to help them to get the care that they so courageously sought. But I love that you said you got to eat too. We have to find ways to make sure we're helping others while helping ourselves. I love all of what you said. And Dr. Cloud, I would love to hear what you have to say.
So Mero actually made a lot of good points. And I really don't have much to add. I think the only thing I'm going to add is when we talk about sliding scale and we talk about Black therapists as well, we have to understand that insurance companies do not pay us. If you have ever worked with, if you have ever used insurance to get paid, I will tell you now that the payout is usually very, 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 very. It's enough to get you a combo meal, depending on the insurance company, and that's if they don't kick back your claim. That's why a lot of people do self pay. And when we talk about sliding scale, you're right. We all do got to eat. We all do got to eat, but we also got to realize that everybody cannot even afford some of the what therapy costs. Like, therapy may be $50 a session, right? Or maybe $75 a session, or maybe $100 a session. And that just depends on what type of therapy or what type of therapist you're going to. And that's just if you're just using self-pay. But if you're using insurance, oh, then it's just terrible. I mean, the pay is just terrible. And when we're looking at the social economic factors, we also got to understand that a lot of people in lower socioeconomic classes, they do not even know the benefits that they have afforded to themselves or for themselves, because nobody takes the time to talk to them about it, right? So people in middle class, people in high class, they know, oh, I have the money or I have the resources. I can go and get therapy, and I don't got to worry about it. Versus people who are poor or have health illiteracy in these low socioeconomic classes, they don't know about this because nobody takes the time out to tell them, right? You can get free therapy sessions at most of your county government offices, right? You get EAP with most of your jobs. They don't know about it because nobody takes the time out to read to them. These are your benefits. Okay, you can use EAP. You can get free therapy session here through the county. You can get therapy sessions for free for sliding scale, or even for free through your insurance at these current agencies as well. Nobody takes the time out to talk to those with low socioeconomic, especially those who are 50 plus, because they have already kind of written them off. And then also the homeless as well, right? Those we see those people. They be there on the corner begging for $1 or something like that. We know they're not fully there in their right mind, but nobody takes the time to stop and say, hey, here's $1, here's some resources. Whether they use it or not, it's up to them. But nobody takes the time to actually stop and say, hey, here's also some resources if you so happen to need them. And I think that's what we so often overlooked it. And then being that mental health clinicians of color are so far and few between, it makes more of an impact when it comes from us. But since there's not that many of us, that's also where the issue lies. I can tell you, I've always been the only Black male clinician in most of the agencies that I work at.
Honestly, I would add to that too. Like it's very rare to see like I think I know like what 2 Black men therapists in my city right now. And something that came to mind as you were talking is even like how I'm seeing some subtle, almost like not subtle, maybe there are very obvious differences also between how the US kind of insurance works in terms of help seeking and mental health, or even the system compared to maybe Canada and where I'm based. And it's kind of fascinating when you mentioned like even the education of like these are your benefits and you should use them. I've met some folks who are close to retirement and they've never used their benefits, and I'm like, what are you doing? Especially here in Canada, like your workplace does pay for your benefits. So as the provider, like you issue a receipt, and then you kind of the client pays, then you issue a receipt, and then the insurance kind of reimburses the client. Typically is how things kind of work around here in Winnipeg. But I know there's some instances where, as I mentioned, like folks will pay out of pocket and like they cannot just afford that because basic needs need to be met first. And so in offering that sliding scale, it means like then you definitely can't afford this, or you don't have good insurance, or you don't even know what your insurance covers, right? So being able to like be flexible with that. But very good points about I just kind of resonated with the fact that you are the only maybe Black male therapist that is available, and that is really a reality of like there isn't just a lot of you out there.
That is so true, Mero. Like in the minority, if you will, Black male therapists. So I, for one, appreciate that you are doing this great work in that representation of Black males. But a lot of good points made, including but not limited to the fact that there are those populations of people, including the homeless or those who are, more impoverished, that may not even know about the care, and people don't necessarily, as you said, take the time to educate them about that. So there is so much room for growth in terms of helping people in general, but particularly those of us within the Black communities to get care, to even know about what is available for us. And then I love the sort of different, countries that, we're living in different spaces, those of us, here right now talking, that our listeners can, understand that there are differences in accessing care and insurance and so forth, depending on where you live. So thank you for adding that insight, Mero, as to how it works in Canada as opposed to
Yeah,
the US
sure.
of A. Yeah. So appreciate that. So as we continue on this insightful conversation, how can mental health professionals be more culturally competent when working with Black clients? I know we've kind of touched on the need for competence. I believe at least one of you mentioned that. So if one of you can sort of take the lead and answer this question.
Let me give it a Mero.
Okay, Mero.
I love being put on the spot. I think being culturally competent embodies a whole, like, it's really covers a whole lot of things. One of the big things for me is just awareness that really coming into therapy, there sometimes needs to be like a lot of education that happens, and just even having that awareness is such a big thing. um I know, like, folks learn about therapy in different ways. Like, we have technology nowadays where people can learn about therapy on TikTok, really diagnose themselves on TikTok, and I think like it's very deeply problematic, but okay. It's still a reality. But just kind of being aware with, like, a lot of times when folks come into a session and they're like, oh, do you think I have this? Or do you think, oh, I want to do this particular kind of therapy? And I'm like, I think it's from a place of curiosity, just like, why do you think you need that kind of therapy? Just to get a sense of like what information they have, taken in. Or some folks think, after 5 sessions, like, therapy is done, like, because that's what EAP afforded them at the end of the day, but not knowing that with maybe private practice and you starting for therapy, it's like, however many sessions you want, you can be in therapy forever if you want. Like, that's your decision. And so really, like, leaning into the education of what even therapy is, and finding even like emotional vocabulary to really talk about what your presenting concerns are is like such a big, those are the two big things that I am realizing are showing up, especially for Black folks looking for therapy. It's a lot of like the, hey, this is what therapy actually is. It's not a diagnosis on your forehead that you have depression. Because I know sometimes Black folks, we really don't do well with diagnosis. It's just kind of like, we have a problem now, and like, then the community thinks you are a certain way or why you behave a certain way, and like those stereotypes kind of follow. So really, like, educating folks what therapy is actually about. Just because you don't have any issues. I started therapy. I didn't even have anything to talk about, honestly, but I'm like 2 years in now, and I'm just like, every session it feels like I have something to talk about. So yeah, just even being aware that folks might come in with no idea of what therapy is, and all the information that they are taking from the outside, and like really internalizing it is really like important as part of being also culturally competent in different ways as a practitioner or a mental health therapist. And I will pass it on to Dr. Cloud to add.
Okay, go ahead, Dr. Cloud. It's you now.
So when we're talking about mental health professionals and being culturally competent, Earl said a lot of good things. I think the only thing we're missing is that we got to understand that the DSM-5 is not for us. I tell everybody this. The DSM-5 is not geared towards people of color, because it's pretty much written from a European standpoint. So those who are not people of color. So we don't always meet the criteria for every diagnosis or every pretty much every diagnosis that's in the DSM-5, because your criteria may say that you meet bipolar 1, and that you also meet a personality disorder as well. And so it's kind of like, I know it's called dual diagnoses, but I don't think that's what's going on right now. And so I tell people all the time that there's the DSM-5 as a Black therapist or as a Black social worker. The DSM-5 is what we use when we need to, but when it comes to therapy, I don't really use it with my Black clients, because I know that it's not going to fully be accurate in a way. Like, we can get you accurate. I know that you're bipolar, but the criteria may not actually be what's being listed. So we have to kind of make sure that we're following protocol. Additionally, one of the communities that we serve, we have to be culturally aware of the communities that we serve and how do we code switch. And as a therapist, I tell people this all the time: who you get in therapy is when I know who I'm working with. And what I say there is like, if I have a client who is from the hood, right? My therapy sessions are not going to be poison proper. It's going to be probably a lot of cussing and a lot of ebonics being used. And that's only because I'm meeting my client where they are. And I think as clinicians, my biggest thing I tell everybody is meet your clients where they are, not where you want them to be. Because where you want them to be is near a state of healing. Yep, we not there yet. I've had clients come in and say, you know what, I'm gonna be honest, I backtracked, I slashed his tires. Okay, tell me more. Tell me why you slashed his tires. Tell me more. Like let's kind of assess this together. Like, what did he do this time? Like, or I've had a client, I've worked in juvenile detention center before. I'm working with juveniles. So I had to meet them where they are, right? Okay. Y'all shot at each other. What's the reason behind it? Like, y'all trying to kill each other? Like, I just want to know where it stems from so we can kind of work together. I ain't gonna put y'all together, but I just need to know what it stems from. And the reason why is because I'm being culturally aware of the populations that I'm serving. I'm also being competent enough to know that all my clients are not going to be on the same level that I need them to be. One client may feel, and that's right. Somebody say, so you personalize it. Yes, I do personalize it because that's the therapy. As a clinician, you have to personalize your therapy approach. Everything is not going to work. When I work with Black women, and I tell people this all the time, women are the one population that scares me to work with. And I tell people this because as a Black male, I may not understand the same plights that you're going through, but I can try to understand. But I'm also very honest that you talking about menopause. I don't know nothing about that. I don't know what that looks like. I don't know what that feels like. I know what menopause is for Black women, but as a Black male, I don't know much about it. So you're gonna have to walk me on this journey with you the best way possible, so I can kind of live through you about what you're going through, these hot flashes, these mood changes, your feelings of your loss of sexual desire. We can work through that together. Versus when I'm working with a Black man, depending on what level he's on, I can meet you anywhere, you know. Versus if we going back to the trenches of the hood, or we going all the way to the upper echelon because you have a couple of college degrees, I'm going to meet you where I need to meet you at. I'm not going to put you where I know that you will not thrive at as well. And that's how we are. That's how we have to be more culturally competent, work with our Black clients. Because I've had clients come in and we have some of the most stimulating conversations. I've had clients come in and I don't know half the time what they're talking about, so I have to walk back through it with them. Let's reassess. Walk me back through this so I can fully be helpful here in this therapeutic environment. And those are the best therapy sessions when you allow your client to be just who they are. You're not, what the problem is, what we're trying to fix or what we're trying to adjust, but you're not pushing them or rushing them to get there because you don't want them to feel like, okay, he just trying to add me to his roster or to his paycheck. No, I'm actually trying to figure out exactly where do I need to meet you at. If you talking about that, you the other day that you backtrack and you backslid, you left your ex alone, and then you backslid and you went back and slept with him or with her. I'm not gonna judge you. Okay, let's talk about it because there are valid feelings there, and we need to get to the root of what made you feel like that you need to go back to that man that was cheating on you so many times, and how does that feel about the value of your own self-worth, right? So I'm being competent enough to know that my clients, I have to meet them with what they presented for me. Sorry, but that's pretty much it.
No, sorry. I mean, I see we have more viewers. I'm glad you responded to somebody in the comments. Shout out to those of you who are making notes in the comments and just viewing. No, sorry. I mean, everything you just said, both of you really, I'm just taking it all in. But among other things that you said, Dr. Cloud, the whole meeting clients where they are, especially us as the people, the Black community, I have hood clients. Sometimes they're gonna come in, as you said, they're gonna be cussing and juveniles. I'm a teacher. I'm a high school teacher at a predominantly Black high school. They always saying something, and but to your point, I help them no matter whatever, and that is so important to that cultural competency. Not where we want them to be, but where they are, you know, whatever it is that they're doing that we might not be doing, but that's not for us to judge. I love how you said that it's not a space of judgment, you know, but I'm hearing like a place of safety. We're seeing so many good things. That just stands out right there. But then back to what Mara was saying, just educating them on what therapy is. They already diagnosed sometimes, I mean, people in general, but, you know, maybe especially those of us in the Black community, before they come in, they already tell you what you have. And it's like, well, let's kind of circle back and dial it back a little bit. Let's let you know what it is. You know, and one of the things that when I think of therapy, people think something's wrong with you, but really, for example, one of my things that I'm like setting boundaries, especially when we go back to the strong Black woman mantra, we just be doing too much. I'm gonna be honest. I've been there, done that. And now one of my main things is no is a full sentence with a period. Respectfully, I'm not gonna do that because I already have too much on my plate. So they think they coming in thinking they got this, that, and the other problem and you're depressed and anxious. That may or may not be the case, but I love your point about just educating of what therapy is and its helpfulness, not necessarily, as you were saying, I believe Dr. Cloud about DSM is not necessarily just coming in and diagnosing you, which I think from my own research and observation, some of the pushback for us in the Black community of going to therapy is like exposing what's wrong with us. And that mindset is problematic because it's not so much what's wrong, it's how can we help you to heal and lead a healthy life and not be doing too much and be in toxic spaces, et cetera, et cetera. So no sorry needed. That was what the people needed to hear. So thank you, Dr. Cloud and Mero for showing this is such a good conversation as I know it would be. So what are some effective strategies for advocating for better mental health services within Black communities? Again, I feel like our conversation is so fluid that we've touched on a lot of these questions in one way or another. But Dr. Cloud, why don't you start? Because Mero always gets the start. So let me go ahead and help her out a little sisterhood for you. Go ahead, Dr.
Thank you.
Let me tell you, Miro, the reason I've been making you start, I do that same thing to my students when I'm teaching. I always be like, well, let me hear from y'all first before I start talking, right? And it makes them get more comfortable, not only with speaking, but about, kind of be like, because when you have a client, what are y'all going to do? Y'all just going to wait for them to start? Like, you know, let me push you a little bit. So that's the reason why I always love to hear from
okay, I see you.
One love. I do that too to my students. Let me hear what you think. They be like, but Miss, what's the answer? What do you think the answer is?
Exactly.
I get it. I'm just teasing.
And I love hearing from the next generation because it lets me hear something I might not know right now. So when we talk about advocating for better mental health services within Black communities, I think the biggest thing that we first have to do is we have to be willing to go into those communities that we once were afraid to visit. And I know a lot of people like, what does that mean? Yeah, we need to be able to get down into the trenches with the worst of them. You know, because that's really where I grew up on the thing that it takes a village. I still believe that it takes a village. And so if we are not advocating for mental health services in the trenches of the Black community, then how can we advocate for mental health services outside the trenches of the Black community, right? Because we're still neglecting a certain part of our community. So if I'm not down there with the homeless, the drug abusers, the needle pushers, the prostitutes, you know, those people that the Black community likes to shun or likes to turn their nose up at, then who am I really as a clinician? Because to be honest, you won't know how many times that I've been to a strip club because I had to meet with a client, right? Or I've had to meet in the streets with a client, and it's after gang activity going on outside. I'm just sitting on the porch, like, oh, they just having a nice little friendly drug exchange on the corner. It's you have to be willing to be there to start in the trenches because that's how you advocate. Because I always tell people, if I can get the lowest of them, the drug dealers, the gang bangers, all of those, the people that we shun to go to therapy, even if it's only for once or two times, think about what we can do if they themselves refer you or they advocate. I mean, y'all know what? I've been going to therapy, so I'm not going to actually pistol whip you. I'm actually going to try something a little bit different today, right? And I can laugh about it because I'm legit pulling this from experiences that I actually have encountered over my years of working one-on-one. Like, Dr. Cloud, I ain't even punch him. I told him, I'm working on something different. I'm actually going to talk about this with you. I want to punch you, but I'm not going to yet. I want to see exactly how this conversation goes. And then I might punch you afterwards. She said, I call that progress because usually I would swing first, ask questions later. Now we're trying to do something different. And that's how you really advocate. Though to me, I think a non-traditional therapist. I believe that being non-traditional really works because when you are doing the work and you are advocating for these strategies, we make sure that we're also advocating for more money, right? Let me tell y'all, we can't do nothing without no money. You can't do no services without no money. You can't really advocate without no money. But if you start from the bottom, like Drake said, we'll make our way to the top. But make sure that money is somewhere in that level. And because that's how you also advocate. That's how you get more mental health commercials, more mental health services. For we're able to, there are grants out there as well that allow people to. The grant pays us to give free therapy sessions, right? And a lot of people don't know that as well, that as therapists, those are effective as well, because how can we give therapy to people who don't have insurance, who don't have the money, right? We need to make sure that we are reaching out we're using grants, we are reaching out to these agencies to partner with them as well, and that we are starting from the bottom, because that is the way to get through to the community, by working with the ones who are shunned and working our ways up, because you are showing everybody that I see you, I value you, and I hear you, and that nobody's going to be overlooked on my watch. And I think those are the effective strategies. That's just for me. It may not work for everybody. I ain't gonna say everybody going to the hood and try to work with these people, because that may not be your environment. That may not be something that you're comfortable with. But for me, I'm comfortable in it because I've had the chance to experience those different types of lifestyles. So to me, I'm comfortable with going sitting on somebody's porch in the middle of the block, y'all out there gambling, shooting dice, selling drugs, and it don't phase me. I worked in CPS before. I've seen people shoot at each other during a CPS visit. It don't phase me. It's just a regular day in the neighborhood. But that's just because I have been conditioned enough that those things do not phase me, and I'm here for a reason, and that's to help. So ain't nothing gonna scare me off too fast and left my life in danger. And mostly the time, my life ain't in danger, so I don't really care.
Mayro, good luck adding to that. But real talk, Dr. Cloud, you bring meeting people where they are to a whole nother level. I applaud you. All of what you said, listeners listening, people watching, people might be commenting, they are. Mayro, yeah, good luck adding to that. But no, real talk. Thank you so much, Dr. Cloud. That is all real. Everything is true. And I love how you said, maybe we're helping, as clinicians, helping that, gangbanger, what have you, they might be less likely to pistol whip somebody. And the ripple in the community, let's talk about that. The ripple in the community is so powerful when we meet people where they are and we help them, and, in their lowest, as you say, in the trenches. That's really who needs really help. And I love how you mentioned about getting the money. Many of us don't know how to get grants, and there's money out there, but we don't always know how to get that. So I think sort of a collaborative effort of helping one another, being that we're few and far between, helping one another to learn how to get the money to help our clients or potential clients, that's so important. But Mayro, I will let you add your thoughts as to effective strategies.
I would just quickly affirm, I was just like, preach, Dr. preach. But one thing I wanted to highlight too was just like the importance of community as practitioners ourselves. I think there's definitely strength in numbers, and so really aligning, because I have an idea. I think what's happening, because there's so many of us out there, I think sometimes competition kind of comes up with clients and really honing or building your practice. But there's really beauty in a group of practitioners coming together and are hey, how can we support this? I either offer my space or, that are very community focused in terms of building and supporting people. And so for me, one of the huge things I've been doing this year is actually building my community of practitioners around the city and being hey, who kind of aligns and wants to do the same work that I'm trying to do, but maybe don't have access to a network that could help us financially, or like what are the different ways in which we can come together and really provide a space, or somebody has a big space but they're not really using it to the maximum potential. It's like, okay, maybe I can hold groups there, and like, how can you really have this community building but together as a group of people. So yeah, just emphasizing that there is strength in numbers in terms of advocating as well.
I agree 100%. As I was mentioning about, thank you so much, Mara. As I was mentioning about that collaboration, and it sounds like you're already doing such a great job in your local community of bringing, together practitioners, clinicians, those who want to help. There is such strength in numbers. I mean, that can't be overstated enough. So absolutely. So as we are winding down, oh my gosh, I don't even want this conversation to end. I am so happy that y'all are here. So what resources or organization exists to support Black individuals in navigating the mental health system? No, I mean that. I am truly enjoying both of you here and sharing. So who would like to address that? Resources.
Well, I was like,
you want to go ahead? We have Mayro going a lot. She was the student that goes first, as we both say. We utilize that strategy. So let's go ahead and help her out. Let's help the students out, the young people, the younger generation. Even though we both are young too, because #Black don't crack. So we can all relatively be the same age. But I'll let you go, Dr. Cloud.
So when I think about organizational resources exist, so you have I always say, I call it SAMHSA. I don't know if that's how they pronounce it, but I call it SAMHSA. So that is one of our mental health organizations as well. So SAMSHA is SAMHSA. And I ain't pronouncing it right. They can contact me later. But SAMHSA is one of the organizations that is a mental health organization. And they have resources up on there about mental health care. They also have resources on there to find mental health services within your area. Other resources as well is your local, depending on where you're located at, your local health department or your should have a mental health sector or division that does mental health therapy as well. Usually free, depending on socioeconomic status or sliding scale. So one of the two. Also, another one is your local employee. So we talked about this earlier, EAP. If you work for a company, you have EAP. It's an employee assistance program. I think it's like probably depending on your agency, it might be 6 to 8 sessions, short-term therapy session, and then they refer you out. So make sure that you are all using your EAP. I tell people this all the time. If you have a problem at work, please use your EAP. If you have FMLA, you can also get short-term disability and FMLA usage as well. If you're dealing with a mental health issue at your job, talk to your HR department as well. That's actually a great resource as well, because your short-term disability or your FMLA is for you. It's for you to use. It's for you to take care of yourself mentally as well. So I'm in North Carolina. So I also be the Department of Health and Human Services as well. That is an organization that I often use and refer people to look for mental health services within their county. If you are in Mecklenburg County, where I reside at, then of course I ain't accepting no new clients. But you are more than welcome to reach out as well. As I tell people, I know plenty of Black therapists. By the grace of God, I have a great network. If you're in Kentucky, I know a plethora of great Black therapists as well. I think because that's why I got my doctorate from is in Kentucky. So I know a plethora of Black therapists in Kentucky as well. Georgia, I know some great Black therapists there as well. So trust me, I got you. If you reach out, I can give you a few different states, not every state, but I know a few in different states as well, just in case. So I think those are pretty much all the resources and organizations that I know about now as well. And then also you can reach out to me if you are a Black male and you just want to talk. You always reach out to me through email or through my company, which is Black Men Need Love Too, which pretty much looks at therapy for Black men and getting you resources or getting you referred to a therapist of color.
Okay, well, y'all reach out to Dr. Cloud because he is availing himself to help you. So that part. Miro, what would you like to add?
He went through the whole comprehensive list. If you are looking Canada specific, feel free to reach out as well. I do have some, as I said, I was building quite a bit of network And so like can definitely refer folks out, but also knowing that I don't know if it's similar to the States, but we do have different provincial regulations. So I can't be everybody's therapist because I'm licensed in particular provinces and not others. But just saying that if you are in need of help, and like even if you know one therapist and you're feeling like, oh my God, their prices are so high, or like, I don't know any resources, still reach out. I feel like even though you're not a potential client or whatever, like there's still that help that happens in terms of a consult call, or just being like, hey, I can give you 10 minutes and we can like talk about what your options are. And as Dr. Cloud stresses, like really look into your benefits at work and all the things, because there is money there that you are not using and should be used.
All right. Thank you both on that. So yeah, Mero, you can be reached as well for help. And I appreciate both of you sharing the resources as well as availing yourself to help the community. So lastly, what advice would you give to someone who feels hesitant to seek mental health care, maybe due to some past negative experiences or just even distrust in the system, of which I know was discussed earlier as far as that, lack of trust. So what advice, Mero, what advice would you have? Let's start with you, please.
Okay, I'll have to also leave very shortly after this.
Yes,
but
so, and we're about to be done. So yes, go ahead.
Okay. But I just say don't give up. Honestly, there is help out there that could definitely support you. And I like to think of therapy is like, or seeking help is like shopping, honestly, to give it a lighter note. You can shop if you're looking for an outfit, you go to like 10 different stores if you don't find the one that's the right fit. But just keeping in mind that eventually you'll find that right fit. So be it like even shopping for therapists and being like, hey, like I met with my first two, they were not a click. Don't give up. You will find your fit at some point. So yeah, just kind of giving therapy like that light air of just like it's continuously trying. And once you get your right fit, I think it might just be worth it. So yeah,
Thank
just don't
you
give
so
up.
much, Mero. And then Dr. Cloud, do you want to add anything to that? I know Mero has to go and we are about finished with our time. But again, I've just so enjoyed this conversation with both of you. So Dr. Cloud.
I would say the only thing I need to say is that you are worthy and you're worthy to be seen. And so therapy is not a detriment, or it does not make you less than for seeking therapy. So reclaim that. So reclaim that ability and kind of reframe your thoughts that therapy makes you seem like something is wrong. Therapy is actually the greatest thing you could do for yourself if you need it. And as you continue to kind of navigate this realm of mental health and navigate the realm of kind of figuring yourself out, just remember your why, or I say your why as in, why am I doing this? What is it? What is the reason behind it? And take that with you into that therapeutic space, because you will see that once you know your why and why you want to get therapy, then you will see exactly that major change in your life.
Thank you so much, Dr. Cloud, Mero. Thank you to our listeners. We so appreciate all of you, and have a wonderful day. Thank you so much.
Thank you all.
Thank you so much.
Thank you.
Bye.
Bye.